And welcome back to the morning show. We're talking with Dr. Christina from All Wellness Medical Center. Doctor, good morning.
Hey, it's always a pleasure.
Good to see ya.
I know.
It's just there's so much going on with you right now. I can't even begin to keep up. We've spent probably the last half hour before we started this just talking about some of the great things that are going on with AWMC.
I know. It's the whole idea is bringing in that new concept of preventative medicine. So we're kind of really getting started, and a lot more people are so involved with this because they don't want to just be given a pill or do things like that. They want to have some new ideas. So it's really getting very, very popular. I'm very excited.
I think with all of the notoriety as of late, insofar as people being addicted to pain pills and whatnot, it's scaring some people.
Absolutely.
It's scaring them into realizing that just pushing the pain down with medication doesn't necessarily always work. You've got to get to the root cause, take care of that, and then go forward.
Right, because all we're doing with pain medicine is just putting a Band-Aid and not really finding the source
Right.
of what the problem is. If it happens to be a slipped disc, if it happens to be something else, arthritic changes, whatever, if we can find out what the true cause is, then we don't always have to be pushing the medication.
Sure.
And then along with the medication, what ends up happening, people come in being constipated, but more than anything that I've ever seen over the past 3 weeks are people coming in very nauseous and vomiting.
Really?
Okay? Yes, and the thing is that the audience has to realize what is important, when do you go, because you don't want to wait for the very last minute. So I'm going to kind of tell you, not that we really want to talk about the color of vomit.
But wait, let me ask you a question.
Yes.
I understand, there's the curse of drinking and the porcelain prince and everything else. Most of us are familiar with that, although it's been many years, thank God.
Right.
But are you saying that people are having this issue without having been drinking or something like that?
Correct.
This is just something that's
Correct.
coming on?
That's true.
Serious?
And some of it has to do with food poisoning.
Oh my.
Some of it has to do just because you get the flu and you end up vomiting.
But there's been a larger incidence.
Right, more and more and more, that people just can't keep any liquids down or keep any foods down. And there's some myths out there that we've got to be careful with. But when do you go to the doctor? Well,
Yeah.
number one, if you're vomiting bright red blood, that can be coming from varicosities that are in the esophagus. We can get varicose vein there, or it can also be because you have an ulcer, or you can have what we call inflammation of the stomach lining, or the what we call the small intestine.
None of it's good.
None of it's good. So if you're having bright red blood, you've got to go to the doctor. Second would be coffee grounds. If you are vomiting coffee grounds, the whole idea, that's old blood.
Okay.
That is where the hydrochloric acid in the stomach goes ahead and kind of makes that bright red blood into old blood, but this is more of a lower GI bleed, okay? The third thing would be if you're vomiting brown. You do not want to vomit brown stuff unless, you got to remember, did you drink coffee? That would be a different story.
Right.
If you ate Jell-O, that would be a different story. But brown stuff, that means could it be a bowel obstruction? And it's like a clogged toilet. So what's happening,
How's
instead
that
of,
go down with your post toasties this morning?
I know, so sorry. But instead of being able to have, to have a bowel movement, what ends up happening, everything goes up, so now you're vomiting stool.
Oh, good Lord.
I know, it's very bad, and so some people don't realize that.
Boy, and talk about bad breath.
Yes, that's true. But the other thing is also you can have green or yellow vomit, and what that has to do is with the stomach is empty,
Right.
so now it's coming from gallbladder. So you got to be thinking, why is bile being put into the stomach? So all these 4 different colors really should be investigated by a doctor. You shouldn't be waiting 2 or 3 weeks to see if this thing is going to go over and start taking Pepto-Bismol or start taking antacids or start taking something like that. No, people need to go to their doctor immediately. Then you look at what are the different causes of this besides drinking. Okay?
Right.
Yeah, drinking can do it because we all get nauseated if we end up drinking too much.
But
in the
that's
morning of it.
self-explanatory the next morning.
Exactly. That I wouldn't worry so much unless it persists. It continues and continues, and you end up having like a hepatitis from that. But let's talk about some really easy things like the flu.
Okay.
It can happen.
Okay.
Food poisoning. It can happen.
Okay.
Motion sickness.
Absolutely.
It can happen.
Yeah.
An inner ear infection can get you to the point where you want to vomit all the time.
Right.
But you can also have medications, birth control pills. Okay. Pain medicines are the worst. Antibiotics can cause you to have nausea and vomiting. And one of the things with the antibiotics that you have to be careful with, a lot of people say, well, if I vomit, then I have an allergy. That's not true. It just means that this is a side effect. It's not an allergy. And,
Really, yeah.
Right, okay? So then you got to be looking at, are there some more serious causes like pancreatitis? Absolutely. So if your pancreas becomes inflamed, and I've never seen so many people with pancreatitis here in Bullhead, Laughlin, Kingman, because I've got getting them from all over, including Lake Havasu. Sometimes we can have what's called a subclinical pancreatitis, where the pancreas is not acute yet. So this is like the early signs. So if they're starting to vomit, and due to that reason, they need to go to the doctor early.
Now, what color? What? All right. Number one, what the hell does a pancreas do?
The pancreas has to do, a lot of us know it more so as controlling diabetes.
Okay. All right.
And there you have what we call the little islets of Langerhans, and it has to do with the insulin control. So
Okay.
people who are diabetic, all of a sudden, if they have inflammation of the pancreas, a lot of times people end up in ICU. So this is one of the reasons. So if you're vomiting, we got to make sure that your pancreas is not messed up. We got to make sure that you don't have appendicitis. But the most important thing, say for example, you fall down, you hit your head. Most people say, wow, that should be nothing. But if you're starting to get nauseous and vomiting, you really need to go to the emergency room.
Concussion.
Because it can be a concussion or you can have a bleed. Okay?
Oh.
And some of the symptoms that you would have is when do you start getting worried about it? You're going to get dehydrated. Your skin is going to start looking very dry lips. You're not peeing as much as you should. And the other part of it, even if you try to cry, you're not going to have any tears. You can start having a rapid heart rate and also become very dizzy. So a lot of times what we tell people, what do you do when you can't keep anything down? Well, at least try to keep down water. Try to keep down electrolyte water. Try to keep down Gatorade, all right? Because at least those have the supplements or the electrolytes, so you do not get potassium deficient. Because
Right.
if that happens, then that can affect your heart. You can get a heart attack. And this is just, it can go to something that is totally preventable by going to your doctor early. But the one thing that I would tell your people, please, if you're nauseated, vomiting, 3 things. You do not go and drink soda water or Coke. You do not drink caffeine. You do not drink juices, because that can dehydrate you even more.
Oh, maybe an old wives' tale, but when I've had an upset stomach, and my mother used to, and I got to admit, to this day, when I get a really upset stomach, I'll go with, if I've got the flu or something like that, go with 7-Up.
Right.
A little sip of 7-Up every once in a while, which is soda, obviously.
Right. So there, though, it's the carbonation
Yeah.
that can sometimes make you more bloated and can upset your stomach. So if you just leave it flat,
Right.
that's fine. But make sure it doesn't have caffeine to it.
Okay.
Right.
Okay.
So this is things that people are coming into, and then what we want to do is catch it early enough so that they do not have to go to the hospital. And if you start vomiting, stop eating. 24 hours, 48 hours, clear liquids. Then you can start bringing in stuff like, for example, broth.
Right.
All right? And then add one thing at a time, but nothing heavy, nothing greasy, nothing like that. But if there's ever a question, if you're nauseated and vomiting greater than 48 hours, please go to your doctor, because we want to catch things early, because if your electrolyte starts going off, it can affect your heart.
Sure.
So then that way we can supplement you with potassium, we can supplement you with giving you medicine to stop you from vomiting.
Isn't one of the signs of vomiting after being out in the sun, sunstroke?
Yes.
The first stages of sunstroke as
Absolutely.
well, which is a very important thing to understand right now. If you were out in the sun all day long, you get home, and all of a sudden you start feeling ill, start throwing up, there's a very good possibility, and your electrolytes are down, you're dehydrated, a million things. Better get yourself to a doctor.
Right, and you need to be carrying around, especially this time of the year, water, water, water.
Not beer, beer, beer. Okay, water, beer, water, beer.
Water,
How's that?
okay, if you can alternate the two, then I think you're doing fine, okay? Because alcohol can also dehydrate you
Absolutely.
too, right?
Absolutely.
Yeah, besides decreasing your libido.
Yeah.
That's another topic.
Which we don't have time for today. Doctor, thank you so much for
Thank
being here.
you. You're more than welcome.
Just give her a call at All Wellness Medical Center, ladies and gentlemen, and find out what's good for you. And if you've got these issues or know someone that does, maybe you can pass along this information and save their life at some point, because this is very, very important. We'll be back with more of the morning show right after this.